Some bad psychotherapists do not schedule appointments in a way that prevents having two patients see each other in the waiting room. A typical occurrence is that you arrive at the office a few minutes early, sit in the waiting room, and see the patient before you step out of the therapy room. That patient sometimes receives a passing comment from the therapist that slightly reveals what he or she is suffering from. In addition, you might see the patient crying, and you might be crying yourself pre-session if you are coming into the session with a lot of emotion. They compromise your privacy, a staple in psychotherapy. Besides patients seeing each other throughout the sessions, therapists might talk about other patients in a way that they think is discreet. However, you will likely gather enough information about them to be able to tell who they are if you see them frequently before or after your sessions. For example, they might frequently talk about an Irish patient that they have. One day, you might hear a patient talk with an Irish accent while stepping out of the office. They do not schedule appointments in a way that avoids ending sessions abruptly. The moment you think that you are about to have an epiphany, the therapist interrupts you to announce that the time is up. You feel less cared about as a patient and more like a cash dispenser. If they spread out their appointments more, you can go a couple of minutes over time to make sure to end on a positive note, especially if the session was very emotionally taxing. They constantly check their watches or clocks to ensure that you do not take up their precious time while making them work extra minutes for free. They will check their wristwatches or clocks frequently in a way that might disrupt your pattern of thought. One elegant alternative would be to have an alarm with quiet music play halfway through the session and near the end of the session. They are selective about what they write down. You might say a point that you consider not very important, but they write it down. You say $1 million point that you think is very crucial to your case, but they do not write it down. You doubt their understanding of what you consider important. It might be best if they try to write down things more frequently so that moments when they do not write do not stick out as much. They listen too much and give little feedback. This lures many poor patients into a trap. Most patients are probably desperate for a good listener, as average people are not the best listeners. When they do listen, their feedback could be lackluster. Thus, patients are excited to pay professional listeners to hear them talking about their problems. Therapists enjoy this as all they have to do is sit back, listen, and make crazy amounts of money. What ends up happening is that the patient rants in a way that would have been better done alone in his or her room without spending any money. There should be more of a focus on insight therapy. They repeat the same things, forgetting that they said them previously. Those repetitive things stick out the most if they are unique. For example, a therapist might be discussing parenthood with you, saying that we are scared of our parents when we are young mainly because of their sheer size in comparison. Imagine if that therapist said that line 2 more times in the next 2 sessions. You do not feel that he or she is aware of what he or she is saying to you, and he or she is likely not that attentive to your words as well. They ask the typical question of, how does that make you feel? The question in itself is fine, however, when it is repetitive and not followed by constructive feedback, it comes off as a filler that adds no substance to the conversation. They downplay your systems. They think that they are making you feel better through supportive psychotherapy by telling you that you do not have bipolar disorder, for example. What they are doing is replaying the nightmare that you might have experienced with family and friends. You tell them your symptoms and they tell you that you are alright. You then decide to seek professional help, going to the office with full intentions of exposing your weaknesses and embracing constructive feedback and advice with open arms, only to receive a very generic retort instead of true psychotherapy. They give general lectures instead of addressing your specific case. You seek psychotherapy for anxiety disorders, and they give you a lecture about anxiety. If you wanted general information, you could have stayed at home, reading about your problems on Psychology Today or even Google Scholar. You came to the office to seek treatment for your specific case. This is psychotherapy, not a college class. They bring in religion. This is what causes many patients to seek therapists with certain religions or lack thereof, limiting the options. Psychology is independent of religion. One can discuss psychology in great amounts without having to resort to religion. They hit on you. Some claim that many male therapists are gay, and they hit on their male patients, but this could be applicable to all types of sexuality. This might range from the therapist complimenting you on your looks to make you feel better, or asking to touch you in a way that they claim to have to do with your treatment. An example is touching your chest to see whether or not you are doing diaphragmatic breathing properly to prevent or cope with panic attacks. They tell you to give up. Say that you have glossophobia, which is the fear of public speaking. Even before you dispense a few potential ways to eliminate your fear, the therapists try to shoo the problem away by asking you just to not deal with it. Not accepting to escape that fear could exactly be why you came to the office in the first place. They share how they are troubled and or taking meds themselves. This is the ultimate credibility killer. You go to the therapist expecting at least a little bit of them applying their own teachings to themselves so that they have a healthy psychological life. However, sometimes they do this to promote meds, which means that more money will be coming out of your pocket. They are quick to refer you to a psychiatrist. Besides boasting about how meds worked for them, they might have a psychiatrist or two that they recommend after they claim that you are not compatible with psychotherapy when, most likely, they are just bad therapists. They are probably partners with psychiatrists and share some of the profits. Meds are allegedly understudied and they come with more side effects than anything.